We want you to walk around, you guys, and gravity really helps. So when you're walking, it's wonderful. Gravity takes and can help the baby go down into the pelvis a little bit more. You can go on all fours. Sometimes people like that. I'm going to show you these positions. Walking is great. Sitting, this is a birthing chair. Love this. Taylor sitting stretches your hips out and kind of lets your pelvis open a little bit. Semi-recumbent, you can sit down and labor. You guys, the rock stars of labor are the ones who come in and they're inward. They know the contraction's coming. They're prepared for it. They close everything off and they breathe through that thing. And then everybody's quiet in the room, and then they talk. Yeah, they close their eyes, they get rid of all external stimulus. And then they get through that thing, and then they start talking. But you guys, we want everyone to go natural who wants to go natural or unmedicated, right, you guys? And we want to do everything we can to help them get there, okay? We don't want to push anything on them, ever, ever, ever. So you guys, an epidural, while, you know, some of you may want one, you guys, it is a medical procedure, right, guys? Are there risks as well as benefits to an epidural? Yes. So you guys, you know, a lot of people do choose to have unmedicated births, and those are wonderful, quick, natural. You guys, birth is not a risky thing if you don't have risk factors, I should say, and you go unmedicated. You guys, it's a quicker recovery, so we do a lot of support with people who are unmedicated. Here's hands and knees. This is awesome. So especially if your baby's in what position does hands and knees help? Occipitals posterior. So we flip them around, right, you guys? Now standing, a lot of times we stand and have them sway. They'll sway back and forth. Squatting is awesome, helps open the pelvis. Kneeling, we can do this with an epidural. People can labor like this, and see how he has his hand on her lower back, put a little bit of counter pressure, that helps. Lithotomy, this is never recommended, ever, 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 ever. Well, I just want to mark that out. Only time you'd be in lithotomy, of course, you never want to deliver in your stockings either, because the baby will get stuck inside. So dudes, you don't want to deliver your stockings, but if you're in lithotomy, it's usually for a reason. Like, say for instance, you had a really heavy epidural, and we still, even in lithotomy, what would we want? We would want a pillow under a hip, so you don't have what syndrome? Vena cava syndrome, decreased blood pressure. So we hate lithotomy, we try that. You can have semi-recumbent. Now my dude did not get in the bed with khakis and a shirt and a sweater behind me, but your dude can, or your significant other, she can get in the bed with you. You know, but she took her stockings off, so that was good. I've never actually seen anybody do that, but lateral recumbent. So dudes, this is awesome, laboring on your side. This is wonderful. Like, I've had a lot of people labor on their side, labor on all fours and labor on their side. And you can roll from side to side, and that helps the baby get through a little bit more. And then squatting. Love, 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 love squatting. Squatting, squatting, squatting. Squatting opens your pelvis and uses gravity. Okay, so it's the best of both worlds. And then here's squatting with a squatting bar, which we like as well.
So they give birth in that position?
Well, we would rather give birth. Yeah, you can give birth like this. You can give birth in this chair. It has a good open cutout down here. The doctors just don't like to lay on the floor and catch it. You know what I'm saying? So a lot of times, like, they'll say, okay, labor like this, and then we'll get you into the bed, and we don't tie your legs up like this in the lithotomy. We have you semi-recumbent in the bed like this, and you deliver in this fashion, okay? We deliver in this fashion, but if your daughter wants to lay on the floor and catch it, that's okay. Yeah, it's like,
What about the birthing ball?
Love those. The birthing ball, think about the gravity and the pressure. You guys, birthing balls are awesome. Peanuts, we have peanuts. It looks like a huge, gigantic peanut. We put it between your legs and it helps open your pelvis. Those are awesome. We have those at the hospital even. So you guys, I always tell patients that when I used to do childbirth, bring your own stuff in, just because I'm just really weird about infection control. You know what I'm saying? Like, so if somebody ever wants to use a birthing ball and I'm there, I always put a Chucks on it. You know what I'm saying? Because it just, you know, I clean it and then put a Chucks on it. Even though it's been cleaned, I still, you know, it can have contaminants on it, so you want them to be okay. So 5 factors affecting process of birth, your psychological response is unique to each woman. Your cultural beliefs have a lot to do with this, you guys. Again, please do not force your beliefs, your culture, your religion on somebody else. Whatever they want is what they should be able to have, as long as it doesn't what? Hurt them or the baby, right? Hurt them or the baby. Previous experiences, you guys, and a lot of times, even with pap smears, I go to do a pelvic exam, and dudes, they are just, tears start coming, they're just upset, and I say, you know, I always just say this, has something bad ever happened to you before? And they'll say yes. I'm like, look, I'm gonna stop. Because what do they need? They need control. When that bad thing happened to them, they had what? No control. So I said, look, I'm gonna stop. And you tell me when you're ready for me to proceed. And if you don't want to do this today, we can schedule for you another appointment and come back another time. Okay? So a lot of times, same thing here. They come in, they had a previous demise when the baby died, and or they had a really bad delivery, or they were raped, or whatever it was. And so it's unique to them. So they relive that a lot of times, you guys. So sometimes silence is best, just supportive silence. So whatever, I always say, tell me what you want me to do and I'll do it. And that gives them all the control, plus I'm not like yapping and saying things she doesn't want to hear, right guys? Anxiety level, and of course anxiety. So what do we do to help people with anxiety? We send them to childbirth class. So the more you know, the less anxiety you have, right you guys? So like, you know, it's like you guys in nursing school. The more you know about the subject when you come in, the less anxiety you have about the test. And then the environment is the last thing. So you guys, if she's out there in the pond giving birth, it's going to be a lot different than if she's in the hospital giving birth, right you guys? So the environment is of super importance to how comfortable they feel. So of course, we've talked about this. What is it? It's just contractions, the baby moving out of the open door, the placenta coming out, or the birth canal. So how do we know labor is coming? She's going to feel lightened because the baby, remember you get that big bolus of relaxin towards the end of pregnancy? And so now, dudes, the baby is here. Oh, this works out pretty well. So my baby is way up here, right, you guys? And then my baby is like out of room, and it feels this pelvis separate. So now it's going to stick its head down in there to get more room to stretch out. But look what happened up here. Now I can breathe. It's called lightening because this is much lighter up in here. So you guys, lightening tells us that the baby's down low. We have some bloody show. What does that do to the cervix? What? Dilating a little bit. So you guys, if you have lots of prostaglandins, you're going to dilate very slowly. So every time you come in to see me, say for instance you come in at 37 weeks, all right, 36 weeks, what test am I going to do? The big Q-tip, group beta strep, okay? At 36 weeks, I'm going to do the group beta strep test, right? I'm going to send it off. If it's positive, she has to get IV antibiotics during labor to protect the baby from bacterial meningitis. Remember? Okay. Then she's going to come in every week. So she'll come in 37 weeks. I'm going to use my finger exercises and start stripping her membranes and stretching her cervix and encourage her to have prostaglandins in her reproductive tract. That's going to cause her cervix to thin out and dilate, but not in an hourly course, over days and weeks, okay? So hopefully when she goes into labor, she's 3 centimeters dilated already, right? If she's already 3 centimeters dilated, just from the course of the prostaglandins and me stretching her and things of that nature, then she's gonna have a much what? Shorter labor, right you guys? Shorter labor. So bloody show is when your cervix just dilates. Remember those terminal capillaries are very thin and friable. There's a lot of blood flow going there. So when you have just a little bit of dilation, you have bloody show. And then the onset of labor cannot be ascribed to one single cause, but we do know that a lot of it has to do with prostaglandins, right? So if we knew what threw you into labor, we would definitely do it. Does oxytocin make you go into labor? No. We're artificially stimulating labor by causing you to have contractions. Do you guys see that? But it's not your brain secreting oxytocin. Now, when we do make you have contractions and we do an induction, your brain will start giving more. So let me ask you this. Do you think oxytocin contractions hurt more than contractions that are not? Yes, they're double. So people say, are these going to hurt? I go, yes, they are. They're going to be about double the intensity that a contraction that you would have on your own is like. You just tell them the truth, right? And they go, oh, okay. And I say, but if you want medication, I'm happy to provide that for you. And we'll talk about the epidural. So stages of labor, let's go ahead, Jerry.